Hi everyone, welcome to another edition of empowHERing Conversations. I am Disha, the Communications Manager at empoWHER India, and I'm more than happy to host this conversation. A little bit about us. empoWHER India has been working for over 30 years to empower women and girls in rural communities in Raigad region. We focus on essential skills like sanitation, education, and life skills. But more than that, we are about creating opportunities for women and girls to thrive. And this series, Empowering Conversations, is one way of we bringing important conversations to the forefront. So, Sohini, could you please tell us what we are doing today here?
Okay. Okay, so we are going to speak about women health, and one important thing which is there that is, we sometimes miss out on it. That is cervical cancer. When we speak about this name, people like us, the layman females like us, we get scared. We don't even want to do the test, or we don't even want to speak clearly with our doctors. So that's the reason we have got Dr. Anshumala Shukla's assistant, uh, Dr. Roshni. Disha, if you can introduce her. And Anshumala also will be joining us soon. And let's understand what is cervical cancer, how to prevent it, what are the different tests one should do to overcome the fear and everything. And even I want to know, because I also do my tests every 3 years. So is it supposed to be done every 3 years or 1 year? So we want to understand everything from you. Over to you, Disha.
So, just Sohini just mentioned, Dr. Roshni, this is to you. Like, we have heard, like, India has heard about cervical cancer or HPV vaccine since last year, when the government of India were introduced HPV vaccine for adolescent girls, especially.
Yeah,
So, but I
yeah.
feel like ये एक ऐसा चीज है जो अभी भी हम इसके बारे में बात नहीं कर रहे हैं, like Sohini just said. So, we want to
Yeah.
understand ki what exactly is cervical cancer and why is it such an important topic, for the adolescents or the community or everyone in general to know about. So if you could just give us what is cervical cancer and why does it happen?
Okay, so we will start at the basics. So the female reproductive system has an organ called the uterus, and the uterus, the mouth of the uterus is called the cervix. Now, in India, especially, not as much as the West, but in India, because of the kind of traditions and practices that have been happening in our country for years on end, this cancer is one of the most common gynecological cancers in our country. Okay, this affects the mouth of the cervix and it is caused by a virus. Okay, the human papilloma virus, the HPV as we call it. Now, what happens is that why the conversation around this particular cancer is super important is because one of the most common forms of cancer in the country is actually a preventable cancer, which cannot be said about many other cancers, which do the rounds. So now, in order to understand how it is preventable, we first should look into what it actually is. So this anyone and everyone is exposed to the HPV virus. It is it is very prevalent in our society, and the kind of virus that it has so many forms and so many serotypes that you, I, and everyone around on this chat have been exposed to one or the other form of it. But there are a few varieties of this virus which actually change the cell structure of the cervix, the mouth of the uterus, and cause cancerous changes. Now, this is a slow growing cancer. So, early on, even if like maybe in your teen years or your early 20s, or you've been exposed to the virus, slowly this virus will go in, it will start to change the cell structure, it will start to turn the cells towards becoming pre-malignant, which means in your pre-cancer stage. And then slowly as this progresses it becomes cancerous. So what this vaccine does now is that in this conversion from a virus just causing an infection to causing the pre-cancer stage, we cut off the virus at that level. And because this virus is because we have a vaccine amongst us which is going to be able to cut this virus at the level at which it is going to cause a problem, we need to spread awareness about it, because prevention is always going to be better than cure. So this and one of the most common misconceptions is that this is a, like, I know that today we are talking about cervical cancer, but actually this vaccine and this virus uh, extends to many other forms of cancer, like for example anal cancer, mouth cancer, cancer of in case like in the different intercourse practices, this cancer affects men also. So as a result of it, if we spread awareness today and try to curb the infection today, then tomorrow, maybe 10 or 12 years down the line, I can proudly say that this is not the most common cancer in India anymore. And, it's preventable. So that's why this conversation around it is important.
Very true. And I
So
think
just
awareness itself is the action, if you say like
Yeah.
that. So
Yeah,
truly correct.
we always say in medicine that prevention is always better. And I mean, the first level of prevention is to to not allow the infection to happen. But at the second level, it is also important to recognize that the infection has happened. So that's why it's important to talk not only about the vaccine, but also about the most, the common practices that can be done in order to diagnose early what cervical cancer is, and how, what are the signs to look for in order to understand that, okay, now I have gotten the infection or I have gotten the cancer, what do I do next? So the conversation around both of these aspects should go hand in hand.
Like, what are some of the signs that adolescents in general, because we are talking about adolescents, but what are some of the signs that we can look for to get to know that, oh, we might have this, or if you're talking about cervical cancer, so what are the
No,
signs?
as I said, the cervical cancer is a slow growing cancer. So generally, it affects, like, by the time you realize that you have cancer, you will be in your, in your 60s, or your like late 40s or your 60s, that way. So, but for the adolescent, like, in order, like, because it is slow growing, we have to recognize what practices can cause you to get the infection, because of which you go down this path of, developing it at a later age. So one of the foremost things, which especially in rural India, which is like a common practice, is early marriage. So early marriage, early sexual intercourse, and like while I talk about early marriage in rural India, at the same time there is early sexual intercourse. The age at which sexual intercourse is starting in India has gone back by about 5-10 years, even in the urban population now. So as a result of that, since the most common cervical changes, even in the natural cervical changes, happen in your teen years. Okay. Now, at that point of time, when there is early initiation of these sexual practices, there is a chance that you are allowing the virus to enter at the exact same time that the body is undergoing those natural cervical changes. This is the time that it is most dangerous for this virus to come into our body, because while the natural changes are ongoing, this virus can come and mutate those natural changes and take it into the abnormal side. So as a result of that, the first thing that people and adolescents especially, and their parents for that matter, should understand is that at the age of 9 to 14, 15, when these changes are happening, sexual intercourse at that time is a big no. So abstinence at that time is key. Now we cannot control uh, like the practices, but what we can do is that we can vaccinate the child early instead of waiting until the age of 18, 19, 20. We can vaccinate the child at 9 itself, at 10 itself. In fact, at that time you only need 2 doses for vaccination. So that is one thing. The second thing is promiscuity. So multiple like partners can cause multiple kinds of infection to enter. So that is another thing. Third is hygiene practices. Okay. Fourth is the kind of if you especially in rural India, there is a tendency towards having more number of children. So that is another risk factor for this. And obviously the others, lack of knowledge, lack of recognition of the risk factors, and lack of recognition of the signs in the later age. All of these club together into causing cervical cancer to become so common in the country.
so
You
I
had a
have one question.
Yeah.
Yeah, so I have a question, that is, what are the signs one can understand that, okay, there's some problem? Usually what happens, I have seen in some of my inner circle cases, that
Yeah.
maybe it's a very taboo thing that I'm speaking about, but I want to speak about it so that people will understand. Many a times people say that, oh, it's itching. They apply some cream and then they are like, okay, we are done. But later, after 2 years, we come to know that itching grows and it becomes cancer. you know so
Yeah.
what are the different signs that if, and people sometimes say that infection hua hai, sabko hota hai, so what are the signs that one should be looking into?
So we have Dr. Anshumala
Hi,
joining
so
us.
sorry,
So she'll be
but
taking
I'm
forward.
thank
I'll
you.
give her the question.
Thank you so much, Rosh.
There's
Thanks
a
Thanks a
question
lot.
about
Thanks a
the
lot.
signs of cervical cancer.
Signs of cervical cancer. Okay, the best part about cervical cancer is that you have a window of 10 to 12 years to detect it before you can actually and treat it before it actually becomes a problem. So, frankly, not too many signs in the earlier stages. At the most, you may experience some excess amount of white discharge, recurrent infections. You may experience that, or you may have postcoital bleeding. So, the moment you've had an intercourse, you might experience some amount of spotting or bleeding happening immediately after that. So, that's one very big sign. If that happens, you must get yourself checked. In some instances, cervical cancer, if it is adeno cervical cancer, it can also cause menorrhagia, so heavy bleeding also you know and so these are the first few signs of things. So of course, when it becomes very advanced stage, it will be like continuous foul smelling discharge which is happening and bleeding happening all throughout the month. Then that's a very big sign that there's a big mass there which is a cervical cancer. So I think in the initial stages, if you want to get warned about it, any kind of recurrent infections which are happening to you, recurrent foul smelling discharge happening to you, or postcoital bleeding is the first thing that you must get yourself checked for.
So checking is
Got
the
it.
pap
Thank you
smear
so much.
test, right? So when you
Yes,
say
so
about
that's
getting
a screening. Yeah, tell me.
I think there's a lag with Ssohini's this thing, but no worries. So, to the audiences who have just joined in, we have Dr. Anshumala Shukla here with us. Thank you so much, Doctor, for joining so promptly. And before this, we saw Dr. Roshni Khanna, who is doing a fellowship under Dr. Anshumala. So, thank
Yes.
you so much for joining in. And we are having a conversation on cervical cancer awareness and to know about the vaccines, the HPV vaccine, and what can we do for our future generations to prevent it. So, Dr.
Correct.
Anshamala, to give you a gist, Dr. Roshni very perfectly explained us what is cervical cancer, how does, what are the vaccines that we can take for, and, some of the signs like you just continued with, to know that, oh, this can happen to us or this is what we should look for. So
True.
that was something, but I also want to understand, like, how does, like, we have heard about the HPV vaccine that I earlier said since last year. So how does the whole vaccine work for the whole scenario of cervical cancer? If you could explain some of it to
So,
us.
99% of your cervical cancer is caused by a virus which is called as HPV or human papilloma virus. Okay. Now, human papilloma virus is around 150 types. Over a period of years, we've identified four major types of cancers which are known to cause cervical cancer. So you may have HPV infection, which can cause warts. Typically, you'll get vaginal warts. You'll get finger-like projections all around the opening of the vagina, on the vulva, on the buttock area. This can happen to you, and that is a sign of a HPV infection. Okay, so HPV virus, when it is of those 4, 16, 31 types, these ones are the ones that will actually cause a change in the cervix, which is the upper part of the lower part of the uterus. Okay, so like for example, just here, like just to give you an example. So this is how I just show it to you. So this is how the uterus looks, and this is your cervix. Yeah. Yeah, when you're having intercourse through the vagina over here, you've got this exposure of the cervix to all the fluid of seminal fluid and exposure to the virus here. So this cervix is a place where your virus goes and sits inside and starts causing changes in the cervical cells, becomes a part of the cervix, and then causes cancer. So just like we have vaccine against all viruses, you have vaccine against hepatitis B virus vaccine, you have vaccine against influenza virus, you had vaccine against COVID virus. Similarly, we have developed a vaccine which is going to act against this HPV vaccine. Okay. Now, like I said, there are 150 types. subtypes of HPV virus, and so you cannot have a vaccine which is working against all. But out of those high risk type of HPVs, we have identified four against which we are able to give them, support or immunity. So basically, just like any other viral vaccine you would take, this is you're going to take this vaccine. It's going to develop antibodies in your body against these type of viruses, and once those antibodies are formed, you are armed and charged to fight the virus. Okay, so if at all now we may not be able to totally prevent the exposure. That's probably not going to be possible because we cannot cannot keep checking everyone for HPV infection before you have intercourse. So it's not possible. Basically, virus exposure can happen. But if my body is already immunely charged, it already has the defense against this virus. So with the vaccine, I have my antibodies ready. The HPV virus comes in my body system, the antibodies get activated, throw it out of the system, and then that's it. It doesn't lead to cancer. So that's how the vaccine is actually working.
So like a preventive mechanism for our body. Okay,
That's
great. And
that's yeah.
so the vaccines that you're talking about, like the four types, tell me if I'm wrong. The HPV vaccines, we have like four types, which is Gardasil, Cervavax. So these are different vaccines for different types, right?
No. So each of these
No?
vaccines are acting against four types. So there is Gardasil was the original compound that had started up. There was Cervarix also, which was available before. Now I think Gardasil is the only one commercially available, and we recently have our Indian vaccine called Cervavac. Okay, which is made by our Serum Institute in Pune. So basically, that is a much more cost-effective vaccine available. So the Cervavac and the Gardasil 4 are acting against the four major types of HPV which are associated with cervical cancers. The Gardasil has also come up with a newer vaccine which is called as Gardasil 9. So it is acting against a wider subtypes of HPV virus, which are also responsible for cervical cancer, right? So because of those nine, the wider range, probably better, protection is given to them, and you have a lot of cross protection against other HPV viruses. So each of these vaccines, the basic four which cause cervical cancer, protection is there in all of them. So all those four
Okay, makes
subtypes,
sense.
vaccine is one vaccine.
Okay, got it. So I had the wrong information.
Yes.
Great. So if we are talking about wrong information, there is like so much information out there, and there's so much wrong information as well. So what are some of the myths that you have come across, related to cervical cancer or the vaccine itself, and how do you think we can clear that up?
Okay, so the first thing is that people think is genetic. Okay, so a lot of people will say my so and so had cervical cancer, so I can get it. So that's the first thing that you must understand, that yes, maybe how your immune system works is definitely genetic. So how strong your immunity is, and whether you're so there are some people who have very good immunity, so they don't have a chance of developing cancer so quickly because their immunity always takes care of the problem. Okay, but then there are some whose immunity is not very good, so they are prone to developing cancers which they can develop, if it happens to them. But in so basically, so genetically, that predisposition to developing cancer may be there, but obviously, unless you have a virus infection, it's not going to be passed on from your mother. So there is no question of any kind of hereditary in cervical cancer, just particularly this one, which is caused by the virus. Okay. The other thing that people miss that they say is that if I have with a single partner, I don't really need to, do pap smears or to take the HPV vaccine. I think your exposure can happen. It's better that you always take your vaccine rather than believing that, because it just gives you that barrier against any possible HPV virus that might come into place. So these are the two main things that I feel that people think, it's coming from genetics. So I will also get it, and I or even some people. So of course, those who are not married, not having had intercourse, may not do a pap smear. But those who have had, it's very, very important to do pap smears, even if you're as young as 19, 20. If you've been sexually active for 3 years, you should do a pap smear, because that's the basic first thing to do, a screening. See, the other bigger myth is that I have taken the vaccine, now why should I do a pap smear? Okay, so yes, you've taken the vaccine, you build up your immunity, but it is not like 100% ki ab vaccine lene ke baad I will never develop HPV virus infection, or I'll never develop cervical cancer. You still need surveillance. You still need to be checked every 3 years to see everything is there. Possibilities become very low, but you still need that surveillance. It's a very simple test which is done for this. So maybe we can talk about that later. And so that's basically how it goes. So not doing pap smears is again something that's not not something that you can do away with just because you've taken the vaccine. So yeah.
So
Correct.
apart
And I guess
from
most of the
immunity,
information.
yeah,
See, also
Disha, I was asking
realizing,
something. So apart okay, am I lagging? Sorry.
yeah.
It's okay. Sohini, go
Yeah,
ahead.
very sorry. So apart Yeah, so apart from the factors of sexual activity and immunity, are there any other factors that can cause cervical cancer or no?
Mm, it's basically just these. So your exposure to the vaccine and how your body reacts to it. That's basically how you get cervical cancer vaccine. See, the other myth that I was actually going to speak to you about was that a lot of people come in panic situation because there is a pap smear called LBC where you can do an HPV DNA typing. So sometimes people do a screening of HPV DNA and cervical cancer. They do the screening, but what happens is that comes out HPV positive, and they come up in panic situation to think that maybe now I've got the cancer. So virus infection does not mean cancer. So you may get exposed to the virus, you may have a report which is positive, but does not necessarily mean you will develop cancer. It just means that you've been exposed to the virus. Now, the next step for you will be a good surveillance every year to see whether the virus is actually trying to build its home inside your cervix or not. So that's the first surveillance required. Building up your immunity, eating healthy, nutritious food is the other thing that you need to do. So that will make sure that your body is now equipped to fight the virus, and even if the virus is present, if your body is well equipped, it will throw it out. So you repeat your HPV DNA typing again after a month, year or so, and a lot of times the virus just clears itself up. So you just keep yourself in a surveillance. That's it.
That brings so much clarity to the whole thing. Also, like I would add on something that I was talking earlier about, like the information that we get through internet or through social media. So,
Yes, yes.
Sohini, to you, I'm asking this question, like coming from the creator industry, from the media industry, how do you think creators can help putting the right information across, the channels or the platforms?
So first of all, there has to be a regulation. Okay, being a content creator myself, I had a chat with Miss Dr. Anshumala also many a times on this. That they even regarding not just cervical cancer, but even regarding endometriosis, she's a pro. I'm her patient sitting over here. There's a lot of myth, and so the snackable. If you go to Instagram, the content is very snackable. You just scroll and you can see 100 videos within 2 minutes. Okay, and there are a lot of people giving false information. So there has to be a regulation coming in from the Indian government that okay, please, like SEBI has taken a step forward, that the influencers have to mention that when it comes to finances, that we are not SEBI certified. This is as per our understanding. So that helps the general audience to take a step back whether to listen to them or not. Same way, there has to be a regulation, and even that's the reason we are doing this particular live event, which Empower from your team, they will be putting it up all across the social media, which will again be a snackable content, which will give the right information. So that's the reason I requested Dr. Anshumala to come over. She gave her time. Thanks a lot for that, ma'am. Because we need the correct information to go. Even dietary wise, a lot of people say that if you have dairy product or gluten based product which is not gluten free, that also can cause these kind of things. So there are a lot of content creators mentions that you take halim seeds, you put water in it, you mix it, you will never have cervical cancer. So these, everything altogether, sorry I'm lagging a lot, but everything altogether, the correct information needs to go onto the internet, and everybody, not just Kokila Ben, Dr. Anshumala, empowHER, but a lot of other institutes also needs to have their own social media channel, and putting the correct thing that okay, this is what needs to be there. So yeah, regulations are important.
Perfect, perfect, perfectly put across. And I think we can't agree more to that. Dr. Anshumala, I would just like to ask you this thing, like since the, introduction from the government for the vaccine, over this past year, have you seen adolescents come or the families coming and having those adolescents take the vaccine? Or how
Absolutely,
has the
absolutely.
scenario been?
Absolutely. I think with the government announcing it in the last budget to make this available, and then the Indian vaccine coming across, which is affordable, because otherwise the cost could have been very prohibitive for a lot of people. So I think with this scenario, definitely patients are coming in, they are accepting. They ask questions. The mothers will ask, if supposing I'm doing a surgery for the mother, they will ask, I have a daughter, I have heard about this, should I do this? So, yes, definitely there is a lot of encouragement amongst doctors also to push. Even pediatricians will now start educating. So now even we educate. If there's a young girl who comes to my OPD, I will educate her and tell her this is options available. You must think about it and consider having this vaccine done. So and they are more accepting also, thanks to how people are speaking about it. So when everyone's speaking about it, it's not so foreign. You don't get worried. Probably a few years back, I would get some reservations about using the vaccine when it had really earlier on started, maybe about 7 or 8 years back. It had come to India. At that point of time, Cervarix and quadruples, that is a quadruple vaccine, and Gardasil was available, and they would not they would be very skeptical about using it. How much should I use it? And they would forget the dosing at times, and all those things were there. But I think now definitely patients are more accepting, and they are very agreeable to take this vaccine. They are understanding the whole concept. Why?
Perfect. So I feel like the awareness is out there and people are taking action to it. So
Yeah,
that's
but
perfect.
it's like we are a country which is more than billion, and we need a lot more awareness to reach everywhere. We are still very, this is what we're doing from our part, but I think the more we do it, the better it is for everyone. And yeah, so I think we have a long way to go still, but it's good.
Doctor, you travel a
Going ahead.
lot, so just wanted to ask in terms of yeah, Doctor, you travel a lot. Just wanted to ask one last question from my end, then Disha can take over. In the tier two, tier three cities, do you think, see, urban parents are very concerned about their daughters. They know that, okay,
Correct.
vaccines come out and okay, this is
Correct.
who we need to approach. But in the tier two,
Hmm.
tier three cities, how do we tackle this situation of,
Hmm.
encouraging their parents who don't understand or who think that it's a taboo to speak about it. So, how do we
So
take care of those
So that's
places?
where probably now, see, that's the thing, Sohini. Thanks to internet and Instagram and social media, we have become a very, very small world. So, that divide of knowledge which was there earlier on between the urban population versus rural population or two tier, three tier city is not that much anymore. Patients come to me from very small towns asking for robot assisted surgery. Whereas a robotic surgery only available in bigger cities, they're not available in two tier, three tier cities. But they are aware because they've seen it, they've heard about it, they talked about it. So, they are getting aware because see, social media I think is the biggest platform. Everybody now has Instagram. Even those who are in smaller towns will have Instagram. Everybody will want to pay for the data, even if it is not for other things. But data has become very important for everybody. So I think this has been a very big game changer for getting knowledge to you. So getting knowledge to people has now become easier. If we are active on social media and we're talking positively about good, giving the correct information to them, I think it's very easy to reach. So I think your post here on Instagram and media will actually go to those people who are there, and if you're able to tag them and they get the views there, they will get the awareness. So I think that way it has become easier for us. But the other thing that Foxy, that's our Federation of Obstetric Society of India, and UNICEF are doing together for this month is to we had our annual conference recently in January. And as a part of that conference, our Foxy president, Dr. Sunita, has actually put up like a drive for us to drive cervical cancer vaccine for everyone, right? So what we have done is all of those doctors who came from all the countries across in India, all the smaller towns and not countries, smaller towns and everything that they came there, we have told them to go and speak to the schools. So we have a campaign going on where everyone is going to their local schools and giving a talk on cancer awareness. So, once that happens, see, that's when it's coming from a doctor, it's coming from a known source, it's happening in school, people know about it. The school teacher will be able to tell the student can probably then relate to the mother, and the mother will feel it's a reliable source because the school is telling you. So it has to be something which is reliable, that they're thinking about it. So I think that kind of awareness will also help. So going out and reaching out to smaller schools by the local doctor there, encouraging them to do that, I think is a very big step. So that awareness will spread like wildfire, I'm sure.
And when you're talking about awareness, I just remembered this thing. So last year, Empower India was doing community interventions. So in one of the locations in Karjat, we had this community intervention with a group of girls. So when they got to know about health and nutrition for girls, and especially not cervical cancer but anemia, so these girls decided to organize a health checkup camp, a blood health checkup camp
Wow.
for the that village. So uske baad, initially they said ki like the government does health checkup camps, but because they are in such remote rural areas, the women or the men or the girls are not like अरे हो रहा है तो ठीक है फ्री में हो रहा है but इतना कौन जाएगा कौन करेगा, they kind of ignore their health, women especially in these
Hmm.
rural areas that I have seen, they neglect कि okay हाँ हो रहा है कुछ हो रहा है यहाँ पेन हो रहा है तो it's okay. But when these girls got to learn about this, when they got aware, they got the right knowledge, they said कि नहीं हमें अभी ये करना है क्योंकि ये हमें लगता है कि जरूरी है. So the change comes from
Absolutely.
awareness, I think. And post
Correct.
that camp that these girls themselves, they set up around 60 women from two girls and women both, 60, around 60 women came for the test. And uske baad, I guess two or three girls were diagnosed with like sickle cell, and they got treatment for that. Then early an elderly woman who was very severely high diabetic patient, she got urgent care. So I guess ये awareness होगा तब जाके फिर हमें पता चलेगा कि okay yeah, this is like these are the few things that are there, and then the right treatment can be there. But this जो neglect होता है चीजें that rural women usually obviously they do because that's the thing they have learned, that is the way they are aware. But this awareness, this kind of awareness can really help them to transition into an empowered generation that we are
Correct.
also working for. So
Correct.
when you said that like the awareness should be there, the change should be there in these smaller sections of a society is also very important. I really wanted to share this with the audiences and the panelists. So yeah, very true, can't agree more with you. So
That's
yeah,
amazing
and I
work, yeah.
guess
Amazing work. So actually, like, you are doing this community talks in different places, and if you target all the schools which are there, government schools which are there across, I think it will be a very good way to make them aware.
that's what we are aiming for. And
And of course,
so yeah, that was there. Great. And
yeah.
the last question to you, because we won't want to take more of your time. We know you're busy, ma'am. But what one, advice or, that you want to give to the families or the young girls who will be watching this or getting to know about cervical cancer, the vaccines or what they can do. So what is that one advice then you want to give to both families and the girls?
So, like you said about anemia, so like when they're young girls who are now between 12 and 13 and they are starting their period cycle, I think mothers and girls, both of you should be aware that your normal period should be lasting between 2 to 7 days, and it should come anytime between 22 to 35 days. So, agar if your period is coming very every 15 days or it is lasting for a long period of time for 10 days, go and get yourself checked because there could be a slight hormonal disorder causing this to happen. And the moment you start your periods, for all young girls, please start taking iron supplements because nutritionally, if you are not very good with taking very good nutrition, this bleeding which will happen to you every month is going to lead to chronic blood loss, which has a lot of other implications in the future. So, chronic anemia is will can stunt your growth also as well. So it's a good idea to always take iron supplements. So the mothers there, once you know that your child has started her menstruation, make sure she's taking iron supplements so that her hemoglobin remains at a good level. Uh, At the moment she's 13, 14 years of age, consider doing a cervical cancer vaccine. Cervavac is available. It has to be given in 3 doses, 0, 2, and 6 months. So 3 doses, any local general practitioner around you can also give it to you. It's a very simple injection. Doesn't matter which time of the cycle it is, it can be given very easily at any point of time. So make sure that you do that as well. And also the other thing, which is something that I always want to educate people about, is that you must understand what a normal period cycle is. Okay, so your normal period cycle is 2 to 7 days of bleeding, with every 22 to 35 days, but with very minimal pain. So if you are one of those people whose child is now getting such severe pain that she's fainting, missing school, requiring injectable painkillers, that's not normal. Don't rub it off telling her that it's going to get better when she grows older, it's going to get better when she gets her pachu, when she gets married, it's going to get better. None of that may actually be a very silent disease called as endometriosis, which can grow in such young girls, cause such a lot of distress, anxiety, anguish to the patients. By the time they become 22, 25, they have damaged their ovaries, fallopian tube, and uterus, because this was not diagnosed at the correct time. So normal period, mild cramps for a day is perfectly fine. But if your cramp is going to go on for longer than that, and 2 to 3 days, the pain is very severe, you're fainting, you can't go to school, please, please, please get yourself checked for endometriosis. Very important.
Perfect. Thank you so much, Doc. And I guess this information is actually going to help a lot of girls and their families. So I just want to thank you, Dr. Anshumala, and Dr. Roshni for taking it ahead
Yes.
previously.
She
And
was
yeah,
very kind enough
Sohini,
to
if
come.
you're
I was
back.
just getting slightly delayed in the OT, so I told her, please go ahead. At least I don't want to, for you to get late on that. So I'm very thankful to her as well. Yes.
We understand that you are doing
Thank
the
you, ma'am.
most important work. Yeah. Sohini, you're back. Okay. I guess Sohini is still lagging, so we'll just quickly
Yeah,
close this off. So
close this off. Yeah. Thanks a lot, ma'am. Thanks a lot.
Thank you. Thank you, Sohini. Thank you, Disha. Thank you so much. Bye bye.
perfect. Thank you so much, ma'am. Bye bye. Take care.